Well, malaria is an infectious disease, and it's caused by a parasite called falciparum. We have 5 parasite species that cause malaria in humans, and 2 of them, the Plasmodium falciparum and Plasmodium vivax, are the most important for the human transmission. And how it can get to us, actually, it can get via a bite of infectious female Anopheles mosquitoes. In 2016, because we have the data for 2016, we have 216 million malaria cases worldwide, and we have 445 deaths. In the African region, we have 90% of all the malaria cases worldwide and 91% of all the malaria deaths. And 70% of the deaths that we have annually worldwide, they are at kids that they are 5-year-old and less. And something else that I think is quite striking is that 2 countries in Africa, Nigeria and Democratic Republic of Congo, counts for the 35% of all malaria cases. That's a huge, huge, huge burden in these 2 countries. Malaria occurs in sub-Saharan Africa, West Pacific, Southeast Asia. We also have cases in Eastern Mediterranean and in the Americas. In a nutshell, we can say that the countries that they are affected from malaria are the ones that they are in tropical and subtropical regions. 2 countries, Nigeria and Democratic Republic of Congo, accounts for the most of the burden in Africa, with 35% of all malaria cases worldwide. Also, 70% of malaria deaths occurred at kids that they are 5 years old and below. Malaria is transmitted from an infected mosquito bite, and this is the female Anopheles mosquito. And anybody can be at risk. Anybody can be at risk. Especially the people that they live in the sub-Saharan African countries, West Pacific, Southeast Asia, Americans, and even Eastern Mediterranean areas. The most in danger are the kids that they are below 5 years old, the pregnant women, the patients with HIV/AIDS, the non-immune immigrants, and as well as travelers that they are also non-immune and they travel to an affected country. The symptoms of malaria, they occur 10 to 15 days after the infected bite. And the main symptoms we have are headache, fever, chills, muscle aches, and also tiredness. We can also have anemia afterwards, and if it is not treated, because I have to really repeat here that this malaria is both preventable and treatable. If it is not treated, we can have severe complications that this can lead to kidney failure, seizures, coma, and even death. It can be treated mainly with pills. You can take a pill that this is an artemisinin combined therapy, and this is mainly for the malaria that is caused from falciparum. And if we now go to the other malaria that caused from the other parasites, the malaria vivax and ovale can be treated with chloroquine as a first-line treatment. And we can also use primaquine only on the liver stages of P. vivax and only if we have a low transmission of the disease. We can prevent this disease, and how to prevent is just to prevent the mosquito biting us. So we can sleep under an insecticide-treated bed net. We can use repellent on our skin. We can also wear clothes that they have long sleeves. They're quite light, also light colored. And yes, if we are going to travel somewhere, It's very well recommended to visit a travel clinic and ask some advices from the doctors, and if needed, to also take some malaria prophylaxis. Resistance, resistance, resistance. I have to say that 3 times because it's really very important. And this resistance is both to the insecticides that they are currently used, plus also to the drugs that we have currently to treat the disease. For both chemicals, we do have resistance. If I take as an example the drugs that we use, currently we have increased resistance in the Southeast Asian areas. If we don't have in the next year a drug that actually can complement the existing artemisinin combined therapies, then we are in big trouble. We have the artemisinin-based combination therapies. So these are drugs that we have them quite some years. What we are currently see is that we currently have resistance to this drug, and this resistance started from the Southeast Asian countries. So it's an alarm here that we have for these actually drugs, because if we are not going to have a new combination of drugs very, very soon, we're going really to have a big trouble for treating malaria. There is a lot of research currently in malaria, and these research are in different topics. A lot of research is going on with the vaccines. Let me mention here that currently we have a very promising candidate for a vaccine. We don't have it yet in the markets, but this is called the RDSS. And as we speak, there is a rollout of pilot studies in 3 African countries, in Ghana, Kenya, and Malawi, and we're really looking forward for these results. This will be a kind of combination of the control tool. We're not going to just erase all the other control tools that we have for the disease. This will be like an addition to what we currently have. And we might, in this way, also reach elimination. We have a lot of research going on for the production of new insecticides, for the production of new drugs, as I referred also before, for production of new diagnostic tools, and also there is a lot of things happening in basic research in malaria. Yes, we might have more funds comparing to other neglected tropical diseases, but it's also a disease that really has a lot of burden. And it raised a lot of interest, but we still need a lot of funds if we really like to reach elimination. We are now in a very, very critical stage. We have reached elimination in some countries, but not in all. And if we stop now, it will be super critical. We will lose all the gains that we have achieved up to now. So we should not stop now. We should really keep on going until we reach our final goal, that this is elimination. If we cannot control the transmission of the disease, we lose all the gains. The disease is coming back. As soon as we stop the prevention of the disease, or even diagnosis and treatment of the disease, we have the disease back. This is proven in the past. We had the very first global malaria eradication program in 1955 from WHO. That this lasted until 1969. At that stage, they tried with 2 different measurements to eradicate the disease worldwide. So they have been thinking on a different actually level than we think today. So the 2 different measurements they had was the chloroquine, and this was for the drug to treat the disease, and they have DDT for the prevention of the disease. Using only these 2 tools, they reach on the level of resistance for both the DDT, for this chemical, and for the chloroquine, for the drug. And what they succeeded is to have 15 countries to eliminate the disease, but that was it. As soon as they stopped the program, because they couldn't see any further development and eradication of the disease, they stopped the program. And then the disease came back, and the numbers, they have been enormous. So we have actually the examples from the past, so we shouldn't repeat the same mistakes. First of all, to raise awareness of what this disease is doing. And we can raise awareness. In malaria, actually, we are pretty privileged because every year we celebrate the World Malaria Day. By doing this, actually, it's not to celebrate, it's mainly to commemorate all the achievement we have done up to now, all the successes we have from the countries, and to raise the awareness, not to stop the efforts that we have done up to now, and to continue until the elimination of the disease. By doing this, donors don't lose their interest of funding, and we have also to pass the message that by eliminating the disease is not only a health problem. We are not making healthier people, but we will have also less poverty. We will have more education. The kids will go to school. We will have really economic growth to these developing countries.